Hi everyone, this is Anna Marie Sinatra from Sinatra Solutions, your coach, consultant, and trainer, and host of Health Matters. You know, right here is when I usually say welcome to Health Matters, but today I want to say thank you for tuning in to Health Matters, as I am committed to bringing you this powerful information to educate you. You're showing your commitment by tuning in and getting into action to make healthy, positive changes in your lifestyle. Are you a big snorer? Has someone in your household told you your snoring keeps them up? Or maybe you even woken yourself up with your snoring. Do you wake up in the morning feeling really tired? And maybe people have observed you stop breathing while you're sleeping. Did you know that not getting a good night's sleep could be affecting diabetes and even weight gain? Well, today we're going to educate you on why it's so important to get a good night's sleep and how you can get a good night's sleep. We're going over to DENT, where Dr. Marc Frost, who's the medical director at the Sleep Disorder Clinic, is going to educate us on how we can get a better night's sleep. He's going to educate us on epilepsy, and not only in adults, but children as well. DENT has been a wonderful sponsor of this program and has provided us with so much information on so many different disorders, so you absolutely do not want to miss this program. But before we get started, let's hear from our sponsors.
DENT Neurologic Institute is proud to support Health Matters. DENT Neurologic Institute offers neurologic education, state-of-the-art diagnostics, and cutting-edge clinical research. If you or someone you know is looking for more information, visit our website at dentinstitute.com.
I'm Dr. John Ziliaks. I'm a chiropractor and New York State board-certified nutritionist and dietitian who's happy to sponsor Health Matters. Together, we are informing the people of Western New York on how to improve their life both physically, nutritionally, and emotionally. Don't spend the last years of your life in a disability zone. Wellness is your best health insurance.
Hi, I'm Kim.
I'm Mitch from Pure Life Energy Saunas.
And together we are proud sponsors of Health Matters, a program that educates the community on how to be healthy, mind, body, and spirit. So follow us because your health matters.
Dr. Frost, it is so wonderful to be here with you today. I'm so excited to hear all that you have to share with our viewers.
Thank you.
Yeah. So before we get started, why don't you tell us a little bit about yourself and how you came to be at DENT?
Okay, well, I've been at DENT since 1996 after I finished my fellowship training in Michigan and my residency training here at the university with the DENT physicians themselves.
Awesome. And tell us a little bit about the clinic and what you do here.
Well, the sleep lab's been open since probably about 1998 that we've had the sleep lab. We started with just the Orchard Park Center and then we expanded up into the Amherst Center. And we work 7 days a week, 7 nights a week, 24 hours a day in the lab here, depending on what type of studies we're doing.
And I know that sleep apnea is something that a lot of people are very familiar with, but for those who may not be, why don't you tell us a little bit about that and for people watching today so that they'll know if this is something that might be for them.
Okay, well, I mean, apnea is the most common sleep disorder that we see here in the clinic and in the lab. And it's really strictly, people think of stopping breathing, but it's not that they stop breathing, it's more of an obstruction in their throat. If they have an enlarged tongue or large tonsils or just a narrow jaw, their throat will collapse on them. It's almost if you think of someone's throat like a windsock, where when the air is moving in it stays open, when it collapses they stop breathing.
And what's really important is if you're experiencing being tired or you wake up, won't people wake up feeling a little bit tired, like they did not get a good night's sleep? They fall asleep really easily, short term throughout the day?
Correct. I mean, that's what they would notice. And it's not just necessarily that they don't feel refreshed when they wake up. They just feel as tired, if not worse, than when they went to sleep.
Wow.
So if you picture what's happening, each time they're stopping breathing, they're waking and essentially choking and suffocating themselves multiple times during the night.
Oh, my goodness.
So it's leading to, in addition to the sleepiness, lots of other medical problems that can go along with the disorder when untreated.
Really?
There's been data that shows that depending on the severity of the apnea, people are at a higher risk for stroke, for diabetes, for high blood pressure, even for dementia. We found recent information for that.
That is incredible. I had no idea. So I know how important sleep is, and getting 8 hours a day is ideal, right? But we don't
Well,
know.
8 hours is the average.
Is the
Most
average?
people can get away with about 5 to 6 hours in function, although function's different than actually working.
Being really clear and alert and
Correct.
precise. Yes, yes. That's so important. Had no idea that it can be a causal effect for other diseases going on in our bodies.
Yeah, and that's one of the major reasons that we end up treating it. There's been evidence that shows that it's going to increase your risk for morning stroke. Morning headaches are common in patients who have sleep apnea, so there's lots of other symptoms that people have that they may not be aware of because they're simply going to be thinking of the snoring that people complain about, and snoring's not the typical issue.
So what about viewers who are watching and they're not really sure what's going on? Maybe not everybody's married or have people that they live with. Some people live alone. How would they know? What signs would they watch for so that they would know whether or not they're a candidate for your sleep study?
Well, the first issue is sleepiness. That's the main thing that patients are going to complain about. And people shouldn't be sleepy, is what it comes down to. There's not, I work hard, so I'm tired. If you're tired, you're not getting proper sleep at night. And whether that's not getting enough sleep when you're in bed or the sleep you're getting is not refreshing like you would see with sleep apnea.
Wow, wow. So they come in and they talk to you, you do a consultation.
Most of the times the patients will be seen by one of the sleep physicians, but they can also be referred here directly by their primary physicians. A lot of primary physicians are comfortable with treating sleep apnea these days. So they would refer them directly for the study.
Amazing. And I know we toured your study that you do, you have beautiful rooms up there.
Thank you.
Not just for adults, but for children too. So
Correct.
tell us a little bit about what goes on up there, what they can expect when they come in.
Well, for the most part, they're going to come in, they're going to be introduced to the lab, shown the area. We try and make it as comfortable as possible. To have to spend the night sleeping with a bunch of wires on you and thinking that people are watching you all night long, we want to make it as comfortable as possible. So it's not going to look like a hospital room. We try and set it up to look more like a hotel room to make it comfortable that way. And they'll meet the techs, they'll be shown the area, and then the study starts. And the first part is getting all the wires put on you, which are always more than people think. There's going to be about 6 wires on your head, a couple of wires on your face, some belts around your abdomen, and some more wires on your arms and legs so we can measure every possible aspect of sleep.
Wow.
We want to get as much information as we can with just one study so we don't have to repeat things.
Wow, very smart, very smart. And now tell me, how in the world do you manage this with children?
Well, there's always a parent there for us, and children typically actually take better to it than adults. Children will typically
Really?
fall asleep better. We're not doing studies on children thinking they have insomnia. So the children are coming in here because they're tired. So they're going to fall asleep pretty easily, and they're going to have a parent there with them. So usually the children typically sleep better than the adults.
Wow, isn't that interesting? And so is there a bed there for the parents to stay with the child throughout
Yes,
the night?
yeah, for when the children are here, the parents have to be comfortable as well. So there will be a
Wow.
place for the parents to sleep.
So parents who are watching today and wondering if this is something that might be going on with their children, what can you say to them so that they would know, again, whether or not this is something that you may want to have done for your child?
Well, children, it's a different set of circumstances where they end up. While children may snore, they're not going to present with the typical loud snoring, waking up, gasping, choking that an adult might present with. What we'll frequently see is children are diagnosed with attention deficit disorder because they're sleep deprived during the day.
Oh my
So it's an important
goodness.
thing if a child does have attention deficit or is having problems at school with learning, retaining material, to start thinking, is there an issue with their sleep? Are they just sleep deprived that they're not able to pay attention and maintain the workload at school?
You know, I'm telling you, I'm so happy to be here at DENT because I have learned so much from every program, and never have I thought in a million years that those issues in our children could be related to their sleep.
One of the most common reasons that tonsils are taken out these days is not because of tonsil issues, but because of sleep apnea.
Wow, that's amazing, amazing. Well, besides moving along too, because I know that you do a lot of work with epilepsy and other disorders here at the clinic as well. So why don't you give us a little overview about some of the other things that you're doing here?
Well, sleep and epilepsy are almost a natural fit together primarily because of the testing that's done with the EEGs and the polysomnograms. And epilepsy is a lot more common than people might think. 1% of the population will have epilepsy, meaning recurrent seizures.
Wow.
And an even more impressive number is that 10% of adults will have at least one seizure at some point in their life, which is a pretty large number if you think about it.
Yes, it is.
So a lot of people are going to have some exposure to either themselves, a family member, a friend, or a coworker who's had one episode of blacking out and a single seizure.
Wow, wow. So when they experience something like that, would they normally call DENT right away, or Do they
Well,
talk-
typically they've ended up in an emergency room.
Ah.
If someone's had a convulsion at work or at home, the first place, it's a scary thing to see a seizure, so the first place people are going to typically end up is in an emergency room, which is where they're typically evaluated first.
And then they come here,
Correct.
and then what happens?
Well, it's just going to be a typical evaluation like we would for any other patient, getting the details of the history, the examination. Family history is important. Some seizure disorders will run in families, so you'll see multiple generations in a family that have different types of seizures.
Ah, well, you know, you're going to really like me even more than you did when I first came in, because this is a great moment to give us our health tip for today, because I talk to them about how to be ready for you when they come in.
Okay.
This is Anna Marie Sinatra from Sinatra Solutions and host of Health Matters with your healthy tip. Create a Word document and write down your name, your address, your phone number, your email, and your health insurance carrier. Then the next paragraph is your family history. There's where you want to list what illnesses or diseases, both on your mother and father's side, are there. And if they've passed, you want to write that information down too. Next, you want to write your history. Anytime you've been hospitalized or an accident, illnesses, very important to write this down. Then the next section is medications and or supplements. Very important to keep this updated too, because they might interact with one another. It's important to let your doctor know this information. Now you'll be ready when you go to the doctors. You won't have to fill out all that paperwork. You can just write in there, please see attached, and give this information to the office staff, and you'll be all set. Okay, now besides that Word document, Dr. Frost says it's a good idea to bring your partner with you, because sometimes he gets more information from the partner than he does the patient.
Nope, and that's true. I mean, I tell patients frequently that there's always two sides of every story and two sides of the bed when it comes to sleep apnea. You'd be surprised
good.
how many patients, they don't think they have a problem, and that's the issue with sleep apnea. They're not even aware of the snoring. They're not aware of the sleepiness. They again think they're tired because they work too hard. But the bed partner is going to tell us that they see the snoring. They hear them stopping breathing. They hear them choking at night. They're the ones who tell us how far away the snoring can be heard in another room, another part of the house. I mean, often I'll have partners come in and they're almost not talking to each other by the time they come to see me because there's such friction going on where the snoring is interfering with going out. They're falling asleep at parties, they're falling asleep and snoring at movie theaters. They can't travel because they make noise in hotels, they can't camp because they snore at campsites. I have plenty of people who are taking their CPAP machines, traveling with them, plenty of truck drivers that will plug them into AC-DC converters to be able to use the equipment while they're traveling. They get the appropriate converters when they're traveling overseas.
Wow.
And I've seen, not exaggerating, marriages saved and relationships saved by these patients getting their apnea treated.
Oh, and I know that that's not an exaggeration, because
Not at all.
I have personal experience with that too, but we're not going to go there. But it's the truth that you don't even realize how bad the snoring is until you travel. And if you, I like what you said about camping too, because I recall a situation many years ago where campers from all over the woods were coming in going, who was that person snoring? You know, because it carries so far.
Oh, absolutely.
And one of the things I think is important too, if you're watching today and you're thinking about some of the big apparatuses that had to be worn, there's so much new technology in that today.
Correct. The machines have gotten a lot smaller than they used to be. Nowadays, the whole CPAP machine with the humidifier is probably maybe a little bit bigger than this brain model there.
You're
So they're fairly
kidding.
compact, and they even have smaller portable ones that are even smaller than that without humidifiers. But if you're traveling, you don't want to carry the machine with you. But once you know what the machine looks like, walk through any airport and you'll see plenty of people carrying their CPAP machines with them. It's a small, compact little box, and they don't want to live without it. They feel that much better with it.
Yeah, I know that there is a huge difference. If for no other reason, once you have the sleep study and you get the CPAP machine, you will be so happy that you watched this program and came in for the sleep study, because it's like having a whole new person inside of your own self. And what you said too, your partner is losing sleep, getting irritable with you, and that's where fights come in. So if you want to save your marriage, you know what I say, the information is powerful only when you act on it. Get yourself the sleep study.
No, absolutely. And we're seeing these days, just forget about partners at home, what's going on with people at work with apnea. People are falling asleep. There's a big issue right now with airplane pilots and train conductors and truck drivers. I mean, right now, if you look at the Department of Transportation issues related to over-the-road licensing, these patients who have apnea need to be certified every time their physical comes up that their apnea is being treated and not at risk of falling asleep.
Wow.
I mean, every time we see accidents, probably the majority of trucking accidents can be related back to the driver being excessively sleepy and having fallen asleep.
Wow. And it's so scary. You know, my dad, when he was alive, was hit by a semi, and that's a real serious accident. Boy, the more we're talking about this, I'm laughing about it because of the experience I've had with it with my husband at the time, but thinking about the seriousness of as we've seen on TV, the train accidents, the airplane accidents, all these things. We're such a fast-paced society, and sometimes, you know, you may not think that you need it because you fall asleep right away, but it's that staying asleep and that choking and gasping for air you may not even realize that you're doing while you're sleeping.
No, absolutely. The majority of times when patients come in for sleep apnea, it's the spouse or the bed partner who's bringing them in. Because I'll ask them, why are you here? And they go, I don't know, ask her or ask him.
Wow.
Because they're not even aware of it. They think they're tired, but they think they're tired because they work hard.
Wow.
They don't realize they're falling asleep when they're driving because they don't see their heads nodding off.
And you know, just in case somebody missed the first segment too, just go over some of the other diseases that come, because I was so shocked to hear about so many other ailments, not only in ourselves but in children, that could be the causal effect from not getting proper sleep.
Right, in adults, the typical symptoms they're going to complain about is the sleepiness. There's going to be snoring, headaches. It's very common for patients to wake up with bad migraine headaches in the morning because their oxygen levels have declined during the night, so they're essentially suffocating themselves during the night. There'll be the sleepiness during the day, irritability. People who are sleep deprived tend to eat more. So they get into this negative cycle where they're sleepy because they have apnea, they're hungry because they're sleepy, they eat more, they put on more weight, and they get worse apnea, and around the cycle goes. You'd be surprised how many people, once their apnea is treated, they find their appetites improve, and they're able to start exercising because they have the energy, and they see more of a positive cycle as the weight starts dropping.
Wow. And how old is the young, because we did talk about also that you have a beautiful room for the children. So what age do you start sleep study for them?
For children, we'll go down to 5 years of age.
Ah.
And if we're looking at seizure disorders and EEGs, we'll go right down to newborns with those.
Wow. And that's Dr. Kasaima.
Correct.
Who does
Dr. Q, as we call
Dr.
him.
Q, yes, who you've seen as well. And if you've missed any of these shows, remember to go back and watch them on YouTube. This is such a wealth of information that we're getting here. It's just incredible. So tell us some more about the epilepsy as well.
Well, like I had said earlier, it's a pretty large population that has it. 1% of the population is going to have recurrent seizures. 10% of the population will start with a single seizure at some point in their life. And a seizure is a dramatic thing. It's not someone getting a headache. I mean, they collapse to the ground, they're biting their tongues, they may be losing control of their bladder. It's a very dramatic thing to see. So people want to know, they're worried. It raises a lot of other issues. New York State has driving restrictions. Every state has driving restrictions for people who have seizures. So it's important to determine, is this something that needs to be worried about? Are you in that 1%, or are you in the 90% that won't have another seizure, and we cannot put your mind at rest about not having anything
So
further.
when someone has a first occurrence, is it a good idea to come in and to, you know, get evaluated and to understand right off the bat, or do they wait? I mean, when people are watching today, they might be relating to some of these symptoms. How would they know when is the time to come in?
Well, as soon as someone has a seizure, it's clearly a significant abnormality. They should be evaluated, whether it's an emergency room. You'd be surprised how many people do not go to emergency rooms after a first seizure. The seizure is brief, it happens, they may not want to tell anyone that they had the seizure, or they're so concerned they don't want to find out about it. But it's important. It's an important thing to know, and they need to realize that, again, 90% of the time there'll be absolutely nothing wrong with them. There are reasons that people have a single seizure. People can have seizures for any number of reasons other than it being epilepsy. People can have seizures because their blood sugar dropped, because their blood pressure dropped, if they're sleep deprived. I don't know how often we see around finals time here, we'll get a UB student coming in who's been up for 3 straight nights pounding the Red Bulls and the caffeine, and they don't make it to their final because they have a convulsion that morning from being so sleep deprived.
Oh my goodness.
So there's lots of other things that put people at risk for a seizure without it being a recurrent epilepsy type of disorder.
Wow.
So you want to know, is it something you have to worry about? Is it something that we need to treat? There are treatments for seizures these days. There's plenty of medications.
So you just gave me another place to go to, how to avoid having a seizure.
Correct.
Is getting the proper sleep and watching those energy drinks that we're drinking and running around too much. What are some other things we could do for preventative medicine? Can we go there?
Well, I mean, the ways to prevent seizures in the sense that you can prevent them. I mean, unfortunately, most people who have epilepsy, recurrent seizures, are going to require medications. And that's been the big change over the last 20 years. Up until about the mid-1990s, we only had 3 or 4 seizure medications to offer people. So you either got better on them, you put up with the side effects, or we were stuck.
Wow.
But over the last 10, 15 years, there's probably been half a dozen, if not more, new anticonvulsants that have come out that work well without side effects.
Wow. And so how do you know which ones you would use on patients when they
Well, that depends on the type of seizure the person's having, what the test results show. I mean, the biggest distinction to make is for men and women. Women have a lot of other issues that need to be addressed when it comes to seizures, particularly having children, childbirth, pregnancy. Up until about 15 years ago, we did not have any seizure medications that were safe for a woman to take in pregnancy.
Wow.
So it was a roll of the dice.
Wow.
They couldn't have a seizure when they were pregnant, but they had to take medications that potentially could cause problems with the baby.
Wow.
So that was a big issue up until about 10 years ago when we finally had some medications that we knew were safe to take in pregnancy. A lot of the older seizure medications will increase the risk for osteoporosis in men and women.
Really?
I have plenty of men in their 30s who have been on anticonvulsants since they were teenagers who have the bone health of a 60-year-old woman because of the medications. But those are things that can be addressed with with the larger number of medications that we have available to us right now.
Wow. Thank goodness for research and more new medications as well.
No, but there's always studies going on. We don't have any going on right now, but there are times we even are part of research protocols in both sleep, epilepsy, and any of the other neurology specialties. We have a research department that is very deeply involved with testing out new medications and looking at new ways of treating people.
So if people are watching today and they've been on a medication and they've had epilepsy or the sleep disorder that they're aware of for quite some time, and they're feeling like they still might need some kind of a tweak or maybe want to revisit the conversation, they can do that as well.
Oh, absolutely. Absolutely. There's always room for improvement with anything. People think they have to put up with side effects of the medication or they have to put up with the discomfort from a CPAP machine. There's enough options out there where they really shouldn't have to do that anymore. We should be able to find the combination of treatments that's going to help with the problem and also keep them comfortable without any side effects.
Oh, that is so beautiful. That is so beautiful. So if you're watching today and you have one of those old CPAP machines or you have a medication that has been prescribed, how long ago now has the new one's been out?
Oh, probably since the mid-1990s is when all the newer medications started coming out.
Oh, okay, good. So hopefully you're staying on top of your visits and you're talking to your doctor so that you're knowing all these new trending things.
But also they need to realize that new doesn't necessarily mean better. Plenty of the older medications serve their purpose. They work really well. I mean, in this day and age of expenses when it comes to medical care, the newer medications are extraordinarily more expensive than the older medications, and it's
Really?
not a reason just to go to something because it's new.
That's
So we have to take
interesting.
all of that into account for the patient.
And that's what you do when they come in during the whole
Correct.
evaluation to understand.
Correct. All the factors need to be taken in, both social factors, health factors, their own personal preference, how often they want to take a medication. Would they prefer taking something twice a day, once a day? I mean, all of this has bearing on what treatment is chosen for them.
That's amazing. Lots of new things I'm learning today. So how would people know about when you're doing a study? When you're doing one of the research studies?
Oh,
that we
those,
talked
okay,
about?
I'm sorry.
Yes.
That,
Yep.
well, they can always call the DENT main number. If they go to our website, there's going to be information about the research protocols that are going on as well.
It's
And
pretty-
typically we'll advertise, and right now we have studies going on in dementia, we have headache studies going on. We don't have any seizure studies going on right now. We have a lot of MS studies going on. That if anyone's interested in helping themselves and seeing if they can help other people in the future as well, participating in one of these studies for us.
Yeah, it's pretty amazing, the website. If you haven't visited DENT's website yet, all the doctors are listed there, all their information, all the different things that are going on here. It's just jam-packed, filled with information.
And there's even some screening tools there. If you're not sure, do I need to see a physician? If you go
Oh,
into,
beautiful.
I think particularly the sleep section has a questionnaire that people can fill out to see, do they have an issue? Are they really tired just because they're working too hard? Or is it tired enough to a degree that they would need to be evaluated by a physician?
Oh, that's really good to know. So they can go there, take that questionnaire, and then determine whether or not
Correct.
they think that is a good place to.
Absolutely.
Oh, that's beautiful.
And there's good
I
references
missed
there.
that one.
And there's references there as well for other websites. We always need to be a little careful when we're looking up stuff online. There's a lot
Oh,
of
my
stuff out there that
goodness.
looks really good, and for the most part, it's really nonsense. So you want to stick with sites that you know are going to give you good information, and there'll be links on our website to that for all of the subspecialties.
Well, that's why I'm so grateful to be here at DENT. We're here at least once a month interviewing different doctors to get this information that is vital for us to have good health. And then again, unless you act on that information and get proactive, it's not going to do you any good. So I'm so grateful for
You're
this
welcome.
conversation. I've learned so much today, and we're down to our last few minutes. I'm wondering, is there anything that we haven't covered that you want to be sure that our viewers get to know?
Well, I think it's important, again, the issues that people don't think about that they should look for when they're having some type of sleep issue. I mean, a seizure, people know when they've had a seizure. Again, it's a fairly dramatic response. But most people will think, I'm tired because I worked too hard. I'm tired because I was playing football all day long. I'm tired because I'm bored is always the biggest reason we'll hear. People do not fall asleep because they're bored. People fall asleep because they don't have the stimulation to keep them awake. Have you ever seen a 5-year-old say, I'm bored and I'm going to take a nap?
No.
Boredom does not make you tired. Boredom does not let you fight the sleep off. So you need to realize that that's an issue. And one of the scary things that I've learned about sleep, and particularly with driving, we're talking about accidents with driving,
Yes.
by the time you've already think you've fallen asleep, you've probably already been asleep for 30 to 40 seconds. So by the time you say, oh, I just dozed off, you actually probably have been asleep for at least maybe a tenth to a quarter of a mile.
Oh my goodness.
So the dangers that go along with that. So it's not something to make light of that someone's tired. I remember back when I was younger, my grandfather would fall asleep in the chair all the time and snore, and everyone just laughed at how funny it was.
Yep.
But thinking back to what I know now, we should have been doing something for him.
Absolutely.
And the same thing today. People are at risk for physical injury, medical issues, as are the people around them. I mean, if you fall asleep behind the wheel of the car, you're injuring yourself, you're injuring all the people that are in the car with you, and you're injuring all the people that are around you.
So we hear how serious this is. So I just want to thank you so much again for sharing this information, and I'm just going to keep begging you to make sure that you get in action, because the information is powerful only when you act on it. So thank you once again.
Oh, you're welcome.
And I'm just hoping that they reach out.
Oh, they can. They just have to call. We're always here.
There you go. Well, there you have it, another amazing show right here at DENT, who gives us such wonderful information, and that information is powerful when we act on it. So I hope you took lots of notes. Remember, you can go to YouTube to watch the program over and over again, along with several other programs, because that information is powerful. So until next time, remember, your health matters. And stay tuned to hear a word from a few more of our sponsors.
Hi, I'm Kimberly Will from Mr. Frank's, and I'm a proud sponsor of Health Matters, and I am very motivated and inspired by all of the information that the show offers.
Amherst Laser and Wellness is a proud sponsor of Health Matters. I'm Teresa Horab, registered nurse and owner of Amherst Laser and Wellness. We look forward to moving you in a healthier direction through our laser lipo and nutritional counseling. So follow us and continue to watch Health Matters on your journey to wellness.
We want to thank Marge Reed from the Healing Spa. Marge is an ordained Unity minister. She has her BA in complementary health, and she's joined by her beautiful daughter Gina, who's a registered nurse. Together they bring us the latest technology in stemology, skincare, stem cell therapy, and holistic modalities for your body, mind, and spirit. Join Marge on Sunday mornings for her 11 a.m. service.